So it's easy compression. Shoulders are loose with you. Loose.
Now right.
Come on, stomach from your face down. Relax your hands. Good. Hey everybody, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic and Physical Therapy in Towson. And I'm with Vinny today, and I kind of want to give Vinny the spotlight, if you will, just kind of your experience and what you've been doing coming in. So I'll kind of give a quick background. Vinny's a firefighter, had an accident at work, had a full thickness bicep tear, went to Dr. Hobart,
Yep.
At
Towson Orthopedics.
Who performed the surgery, and that was early December 8th.
December 6th.
December 6th.
Yep.
December 6th had a surgery, came in and really already had a relationship with our community here, had received care in the past, so he knew where he wanted to go to receive his physical therapy, he knew where he wanted to go to receive his care relative to the manual therapy that we provide. So kind of like big picture, when did you start coming here to this office?
I want to say probably like, I've been coming here for probably about going on 2 years now.
Okay.
Yeah, about 2 years, yeah, because I've been back in Baltimore for about 3. Yeah, so about 2 years, I want to say. Close to 2 years.
You commute down to Montgomery County, work for the fire department down there, and you've been in coming to see our office for 2 years. What brought you in originally?
So I did my research, asked around, looked at some reviews online, and this was the closest to my home, so I said, let's give it a try, and it's been great. Awesome. You guys have been awesome, man. Couldn't ask for more. Nice people, always just welcoming, and definitely the care has been A1 as well.
Awesome. You get to see, so with his current treatment, so he came in, initially my goal with him from a surgery from that perspective is to reestablish range of motion and get you comfortable. But you've utilized a lot of different services. So we do Shockwave for scar tissue management. That's something that's kind of unique to our office, I would say, in this area. But what's also unique is that you've got massage therapy upstairs, doing deep myofascial soft tissue work with you. So you get that angle of care, you've got the Shockwave, you got a group out there where you're doing your physical therapy and your different phases of your elbow and shoulder rehab. And then you're coming in here and you're getting the chiropractic side of things, the manual therapy side of things. So it's just a nice triage of care, especially for soft tissue management. So whenever I'm dealing with like tendon work like you had done, I feel like we have a lot of good resources for you. But yeah, I think you've got, what's Jess been like? You've been seeing her from a massage standpoint.
Jess is amazing. Hands down, best massage I've ever had. And I'm not hyping or boasting or anything, but Jess has definitely been great. She definitely played a role in, the rehab, me getting back to where I need to be. Definitely I'll be doing a massage probably 2 to 3 times a month. For sure.
We're unique in that sense that you can come in, and if they, relatively speaking, they work under our license, so we can get care for people coming in here, and in conjunction with the chiropractic care that we provide. So Jess is upstairs. They don't get enough spotlight. Art is upstairs. He doesn't get enough spotlight. He's been here forever, and he's just amazing. And so I know that from a patient's report standpoint, it's not the first time someone has said that to me. Best massage I've ever had. So they're clinical, they're deep tissue, they're methodical with what they do. It's not just a spa-like setting up there, although it is relaxing. And so coming in here, relatively speaking, I'm going to go through just a little bit of an examination for him. This is his exit exam, if you will, for his injury. I'm going to be looking at his range of motion, his strength. I want to see the quality of his movement. We've kind of talked a little bit about a game plan. He's gotten take-home exercises now. He already knows what he's doing in the gym as it is. So we're programming those into his routine so that he can find the time and space and get back with his family, his little one, and the downtime he has now before he gets back and gets after it at work. So let me show you a little bit of that exam, if you will. Vinny, go ahead and stand up for me. And you can face me. I'm looking globally. When he came in, right, his problem area is here, and that's where the majority of the treatment, if not all the treatment, is happening. From a biomechanical standpoint, I'm going to look at the whole shoulder. So let me see you bring your head back. So I'm going to look at extension in the cervical spine. I want to see if there's any guarding in the shoulder girdle on the right side or even left. I know he had the surgery on his left elbow. Bring your chin down to your chest now for me. But when we were working on him, it's not just in that general area. It's everywhere. And then face me.
This is right elbow.
I know.
Oh, okay.
Yeah,
My bad.
Yeah,
My bad. I'm
appreciate
keeping my bad.
You can sit here for me.
Edits.
Good thing I'm not doing surgery.
I know, right?
There you go. Bring your head back for me. Good. Rotate. Easy. Bring your head back. Rotate. Good. And then bring your chin down. Good. So you can't help but look forward for me, compensate through the initial portion of kind of being in the sling and being resting. So there's a lot of tension that we've been working on in his right shoulder as well. Arms up like this, man. Good. I'm gonna push down here. Hold strong. Don't let me move you. That's rock solid. Arm up. Okay. Hold strong. Pull your wrist to your shoulder. Good. Maintain that. Good. Nice. Hold strong here. So I'm just comparing side to side. I want to see equal strength. Push into my hand here. Hold strong. Good. Thanks. So Michael's helping me out with what's called ART. It's a technique. This is pin and stretch is like kind of the general form of the technique, but ART is active release technique. I'm working on the piriformis and the sciatic nerve kind of in one go. Thanks, Michael, for your help.
Oh, my pleasure.
Michael and I are going to be running this weekend. You going to join us? You want to run on Sunday?
I don't run.
Saturday.
I do anything but run.
You haven't run?
No.
Long distance
Sounds
biking?
like a terrible idea.
A lot of people say that to me.
I like biking long distance,
Mhm.
but you got me into this situation.
Maybe you might realize that. Come on. So I'm applying a fair amount of pressure with my hand down, thumb into the back of the piriformis and the glute. And then right there, she's creating a lot of tension from Michael twisting her leg in that position. So when we externally rotate the hip and then adduct it to bring the knee down towards the floor, it lengthens the piriformis muscle, but it also takes the sciatic nerve, which is slacked right now, and starts to slowly lengthen it. So this is a muscle technique, but for Michelle's case, I'm definitely more focused on her sciatic nerve. And so if you have sciatica, just the position she's in right now, it's called a static opener in my world, but it's something that can provide a lot of relief to some of the nerve pain that she's got. So if she were just to kind of swing her legs over in the morning when it can be at its worst, and just lay the leg over the side of the bed, and hang out there for 2 minutes, 3 minutes, and let it open up. It's a nice way to get going in the morning, as well as some other stretches that we can show you later on. Good. Pressure, yeah.
You're great.
Oh.
The pressure is torture, but you know, it works.
We'll do 2 more just like that, and then we're going to start to lengthen the leg a little bit. So wait, they do Bikram and hot yoga?
Bikram.
Is all Bikram?
No, we do yoga.
So yeah,
Vinyasa.
Vinyasa, that's the difference. So you've learned Bikram?
Yeah.
Oh,
I
nice.
know Bikram.
You did?
Mm-hmm.
Have you taught the Bikram course yet? Class?
Yeah. That's all I teach.
Oh.
No.
Holy ghost.
So sorry.
Go ahead and straighten that leg. Two more here, Michael. Thank you so much. Appreciate your help.
My pleasure.
Is it?
Now your pleasure. Huh?
Just breathe.
Easier said than done.
Mm-hmm.
Yeah.
So we'll go up, and a lot of times with this problem, there's an exam, right? That we do in the beginning with her. There's an audit, what we'll call when we do something. We want to see it improve. For her, it's a little bit of movement in her low back when she's standing. So we'll see that. Sorry, I'm tuck you back up there. So I didn't do the service of tucking you back up, so appreciate you. No worries.
Thanks for your help.
Thank you.
All right, let's do the exam portion of it now, Michelle.
All right.
So
I'm
go ahead
ready.
and step off for me.
Off.
Yeah, face this way, and I'm gonna walk a little bit.
Which way do you want to
This
face?
is perfect. This is perfect. All right, so I'm gonna watch Michelle move from side to side now. Okay, bend to your left for me, Michelle. I'm looking at this line right here in her low back, and then and her general range of motion, as well as how far that hand goes down, how easy it is for her to move into that side relative to the other side. So when she goes into the side of the complaint, and when she goes towards that area where she has that pinched nerve, her body goes, oh. So if you're dealing with that at home, you can kind of test it out. Oh yeah, that's where my problem spot is. That's where the pain is referring. Sometimes it can be opposite. You have the pain going this way, but you can move really well into the pain. Hard to move away. Different issue, usually in the spine. But for Michelle's purposes, you're going to be lying on your side, facing that measure. Okay. So in upstate New York, was it fun?
The Armonk is not really upstate. But
Where is
yeah,
it?
it's nice.
White Plains?
Yeah, it's near White Plains.
Bring a bike.
No, it was family time. I wasn't allowed to escape for a few hours.
Why would you want to escape from all that family time, right?
Right.
You're right. I'm sure your family.
And it was torrential downpours on Saturday.
Was it? So it's easy compression. Shoulders are loose with you. Loose. Good. Good. Slide your back forward. Cool shoes.
Oh, thanks.
Were you a skater?
No,
No.
not at all.
Never.
Never. They're comfortable.
Lie on your side here, face me. So, massage, traction. So the visits that Michelle gets massage therapy, she just gets adjusted when she comes in. There's other visits when she's coming in where she's getting dry needling and traction as well as getting adjusted. And those are separate from today's visit, for example. Right? And so we're combining those things together to create a little bit more of a full spectrum treatment plan for her, get her feeling as good as possible. And then every so often we're trying to convince her not to ride 100 miles in a week, but
A week?
a lot.
Yeah, it's a little more than that, but we won't talk about that.
Good. So you just saw how I treat the problem. Hopefully if you watch the beginning, if you're not like Michelle where she just fast forward to it, you can get a general understanding if you have sciatica that it can sometimes be some time, and a multimodal approach is one of the best approaches. But the best thing she's got going for her, she's headstrong and she's consistent with wanting to do healthy things for herself. So that's why I'm very confident that we'll get on top of this problem for Michelle and she'll be feeling good in no time.
I'm confident in you, Joe.
I appreciate the confidence in me. How's that all feel?
Good.
Good.
Piriform stretches hurt, but they work.
They work?
Yeah.
Good. Awesome.
Until I sit down in the car.
No sitting. Just run home. Okay? Get on your bike.
Alright.
Head over.
It's on my car.
I'm with Cosmo. Cosmo.
Yes.
Where's your wand?
It's all there.
How do you not have a wand? If I had a wand, I would never put it down.
I attached it to like my pencil, so I was like writing with it all day.
Yeah. You've been throwing a lot of magic out,
Yeah.
doing some stuff this
Yeah.
morning.
Making wishes come true and stuff, you know.
Oh, that's awesome. So kind of you. How are your hands feeling after all those
Oh, great.
abracadabras?
Great. They're a little green,
Oh
but
yeah.
they're feeling good.
I took my hands off. They were getting really sweaty. It was super awkward.
Is it wet inside?
Yeah, super
That's
wet.
just disgusting.
I should probably cut that part out. I don't know how much editing we're doing on these videos anymore. Well, that's gonna be great. So. Hold on, back in form. And. Sounds like a pterodactyl getting sick.
Yeah. That's pretty on. It's pretty like spot on.
Yeah, Jurassic Park. Something. So, Hey, we are doing. What are we doing?
I don't know.
Yeah, it just kind of feel like one of those days where we're just hanging out a little bit, but we're also taking care of people's backs. And one way that I take care of people's backs is I adjust them and do manual therapy in the form of a manipulation or adjustment. But for your low back, we're gonna stretch out your hip first. Okay?
Yay.
You sure?
Yeah.
Okay.
I'm so excited.
You don't sound that
I'm so
excited.
excited.
Come over, get relaxed, get comfortable. So, and then honestly, I'm gonna work on your hands because you've been throwing abracadabras left and right and help making people's wishes come true.
Amazing.
I appreciate it for that.
Okay.
You're gonna go to St. Louis
Yes, next week.
on a little trip out there. That's exciting. That's next week.
Mm-hmm.
Holy smokes,
Right?
that came up quick.
I know. I had to get my mom to book the flights because she's going with me. But
Oh, she's gonna have a good time. I'm excited for your mom getting to go out there with you and having a fun time, and also seeing the school out there and getting a little trip to see kind of what's available to you in your future and education, etc. You know,
yeah, I'm excited.
it's pretty cool. They just opened up a nursing school, I think, and an NP school that's attached to the chiropractic school. Or that's a secret plan that they haven't talked about that I wasn't supposed to
Spilling
share.
out secrets.
I know they're doing something. They're doing additional schooling and different degrees. Like you can get your master's degree online while you're going to chiropractic school, which is cool. I can barely see this right now, but I promise you, my hands are leading the way. Okay.
I trust you.
Appreciate the trust.
I trust you.
She trusts me.
I trust you. I do.
All right, so there's a bar downtown called Broadway Oyster Bar, and they play music from like 9 till 2 in the morning, and it's a $7 show all the time. But it's also like, let that go. They're like, it's just a quality, hole in the wall, fun spot to go to. If your mom likes live music, does she like live music?
She does.
Oh yeah, they play a lot of classic rock down there. It's fun.
She'll have fun.
Some blues, some classic rock, a little funk. That's cool. It's a good time. But it's gonna be quiet. There's no sports going on. This time of year, Ballpark Village will be quiet. St. Louis is an awesome city though. Alright. I'm gonna do a little soft tissue work on her right hip. And relax. So sometimes, like, I'm like 7'3", you know, probably like 450 pounds.
Yeah.
I don't know my own strength sometimes. So if you feel like this pressure is a little too intense, just let me know, okay?
Yep. It's fine right now. That feels so weird.
So I brought Scarlett home her wolf mask last night for 3 little pigs, because she's going to be a wolf tonight. And she slept with it. She was so excited.
Uh-huh.
And she put it on. You can come on your side, left side down, right side up. And she put it on and she said, I'm gonna huff, I'm gonna puff,
Bro.
I'm gonna blow your house down, and came up and ran in. It was like the freaking thing in the world.
Dr. Jeff said that today, when in his little Darth Vader thing. You were in there, weren't you?
I think so. Oh, baby. Come on your back. Behind
Like
your
the
side, face this way. It's getting warm in here. As long as I've worn this mask all day, I'm sticking to it. I'm going to go the whole adjustment video without taking it off.
Okay.
But I can't see my
I'm moving, so it's not really helping you, is it?
where I'm going. Alright, easy here. Good. Cool. And back for me.
Okay.
And relax. Alright. Where am I in the room right now?
by the windows.
Okay, cool. Good. Next week, really well.
Oh, that was good.
All right.
It popped a lot. That was cool.
Feel good?
Yeah.
Hey,
So what I'm here
it's
for,
gonna have to
man.
be a regular thing. I'll have to keep this on
I
because
know.
I'm breaking the Chewbacca adjustments.
Yeah, so this is our radial pressure wave, or RPW2 device. It's developed in partnership with a company called Stores, and what this technology is going to do is introduce a sound wave into the tissue that's going to help disrupt and reactivate connective tissue, get it back to a healing state, with the goal of when it's remodeled properly, the tissue will be more functional.
So we're starting with this device. What's this one, Adam?
That is a V-actor, so that would be vibration. Vibration can be used to desensitize the tissue a little bit, create a softer tissue to work with your Shockwave device.
So basically this kind of loosens the person up a little bit before we get to the big stuff.
Yes,
So
sir.
This is the softer approach. The hammer is over here. This allows the person to feel like maybe a little less discomfort or pain when we get to the bigger device, if you will.
Absolutely.
Now, we don't like to say this all the time, even to patients, but this creates a little bit of a damage effect, if you will. And that's a term we use with dry needling quite often. It disrupts the tissue. It challenges the tissue. It breaks it down where it's weak and challenges where it's strong, if you will. So your body has a chemical reaction in a problematic site, right?
Exactly. When we want to remodel tissue, particularly tissue that's chronic, we need that breakdown to signal to the body that a remodeling process is necessary.
So Carly, I'll show you what I'm doing over here. Here's her 12th rib. This is her QL muscle. It's almost like a triangle, if you will. It runs from here to here. A lot of times there's a couple different trigger points that Travell has mapped out that we're going to work on. One's a little higher up, and there's two there in these lower branches of the muscle, okay? And so I'm going to focus on working over that area, and a lot of this is my touch, but it's more so patient tolerance and preference. So how's that pressure? Okay. Are you less scared of the device now?
Yeah, this one, yeah.
That's good. And relatively speaking, this is going to get the person a little bit more relaxed, and I'll be able to take some tension out of the superficial portion of the muscle, and I can get a little deeper with the other device. Okay. And I already know that you can probably tolerate it a little bit more based off what she's telling me, so I'm going to increase the pressure that's occurring right now underneath the head. This is more vibration-based therapy, not the percussion of force through the skin. So I'm gonna increase it a little bit. We'll get up to a 3 bar. How's that right there? All right, do your cool. You're gonna become famous if you start talking about it.
Like
So-
Dr. Bree says, Carly behind the camera.
Oh, hey. So Kaylee, how did that feel? Did that feel good?
Yeah, it felt like a Theragun, but without the pounding of the Theragun. So it was just like the surface level vibrations. So it didn't hurt. It just felt fine.
Did it feel like a little like massage chair vibe kind of?
Yeah.
Wow, fun.
Yeah.
All right, so we're getting into the next one. So Adam, I'm starting with the radial pulse. He's already got me pressed on the play, and then we're getting action here. So there is a magnet in here that is getting thrown forward and hitting the back of this metal piece. There's different versions of this metal piece. Some are a little bit looser and softer. Some are a little bit more firm and hard. There's a gold-plated one. We have a soft-tipped one that's for like, think of like the top of the foot, where you wouldn't want something hard hitting the top of your foot. And so I'm going to set it up over her QL muscle right here to the edge. I'm not going to go up high. I'm not going to be above any structures that I'd be concerned about. And I'm always going to angle towards a deeper tissue, a muscle, or a tendon that I'm looking to change, if you will. So I want to find the spot, if you will, right? And we're going to find the tighter area that I'm playing about. I'm going to increase a little bit. This is really low. This is at 1. I'm going to go up to 1.5. I'm going to check in with you. Kaylee, how you feeling? So you can see a little redness in the tissue. You can see where I was just holding it there for a little bit. That's totally good. Actually, want a little bit of that over the area that we're working on. And I'm going to find the trigger point, if you will, right there. I'm going to increase a little bit more. How's it feel? So, like as we're going through this treatment with her, like how often I'll do this is I'll space this out by a week. Here, let's do this. Do your cool editing. I'm gonna finish the treatment so I actually can talk.
It moved.
Rest here. So what are you doing these days? You're applying to all kinds of schools right now, aren't you? Good. That's good.
Yeah. Yeah, I am.
Come on your other side for me.
Applying to PT. I have to get some in by the end of the week.
What PT school are you applying to?
There's the one in Pitt, and then there's like PA ones, so like Arcadia, DeSales, Pitt.
Just realized I did that.
There's some in Florida that I'm looking at that are just like near the beach because I just wanted beach schools.
Yeah. There's a chiro school in Tampa Bay, in St. Pete. It's a good school.
Don't tell me that because I'm gonna look into it and then I'm gonna be like, apply.
More options.
Yeah.
I know. I think it's expensive applying to all those schools, doesn't it?
I have like about 10 on the thing and it's like $800.
Come on, stomach from your face down.
Yeah, then that side. I did it by myself.
Yeah, you took care of that for me.
You're welcome.
You're so helpful, okay? I appreciate you. So, breathe in. Easy, exhale, loose. Okay. Keep breathing like that. Right there, I'm gonna move you, okay? Relax your hands. Good. Good. So problematic spot here. I've done an exam with her before. We kind of went through stork signs. She's got a lot of facet irritation in this general area. Soft tissue work over the like the QL and the erector spinae with the Shockwave. We just adjusted her. She's going on some like kind of foundational core and exercises just to help support that area. She's strong. She's a field hockey player for 4 years in college, so she's got a little history of being athletic and moving, but also straining this tissue a little bit doing so. So we're kind of jumping in with a little bit of treatment videos here to show you kind of Kaylee's experience in the office with some of the work that we're doing. And then what I'm going to do for her is I'm ordering a little bit of imaging. Normally I don't do that, but with the history of the sport and the chronicity of the problem, I want to look at her pars interarticularis, which is basically the structure that connects the posterior elements of the spine to the anterior elements, all right? And I just want to just kind of look at, from an instability standpoint, if there's any evidence on x-ray with motion, so extension, flexion films. And then I really think that it's going to be very minimal, but I'm going to do my due diligence here relative to her because she's already kind of responded to some of the things that I've done with her, right? So she's healthy. I'm just going to get some imaging to confirm how healthy she is. And then with the history and the positive orthopedic signs that she came in with, right? So that's kind of a little bit of a backdrop. You get out of here. You're all set for your afternoon, aren't you? You're off this afternoon?
Yes, sir.
Enjoy. Drive safe, get home. Thanks for watching, everybody. Appreciate it, and I'm looking forward to sharing more of what we're doing in here. You good?
Yeah.
How'd that feel?